So today I wanted to do a little video on the GI map with Zonulin test that I use to evaluate what is happening in a person's gut. So pretty much everyone that comes to work with me has some kind of gut imbalances, either with the microbiome flora or most people have gut permeability. So that's something that's been talked about a lot recently, and people really want to know, do they have gut permeability? Because if you do, it puts you at increased risk for all kinds of things, not just within the digestive system, but it causes a lot of inflammation and can ultimately be responsible for autoimmune diseases. So just to quickly not overwhelm you with what is shown on a test like this, but just to give you a basic idea of what you would learn about your body. Initially, this test is telling us what pathogenic bacteria are found within the gut. It tells us whether or not H. pylori is positive, and H. pylori is a part of the human ecosystem for eons. However, we want to see what is it doing in your body with these virulence factor markers. Keystone bacteria, these are different bacteria that we know have positive effects in our bodies and that we want them to be present in a normal range here, where we would look at the green bar. We would want the arrows to be mostly in the green section of these bars. And in particular, Akkermansia is very interesting. That is known to affect our gut integrity. It just builds gut wall lining day in and day out, but can also, when it's not present or when there's low amounts of it, can be responsible for people having metabolic issues. And it's well studied and can actually be supplemented for. And I've seen low Akkermansia in many particularly women who were having resistant weight loss and things like that, and supplementing with Akkermansia helped them a lot. We look at any opportunistic or overgrowth of microbes that don't belong in the body, fungi and yeast, viruses, parasites. A lot of people are doing parasite cleanses right now. And this test actually tests you for parasites, so that's always good to know. And then the intestinal health markers are super important. And way down at the bottom here is the zonulin level. So zonulin is what is responsible for whether or not the junctions in our intestines are tight or leaky. So people are reading and hearing a lot more about leaky gut, gut permeability, and the different horrible effects that has on our body. And many people probably suspect that they have gut permeability, but as my teachers and mentors all said in my training, if you're not testing, you're just guessing. So if you look way down at the bottom where it says add-on test, Zonulin is an add-on that is worth every penny, because it will tell you whether or not you have gut permeability. So this sample report shows this person did. The marker is in the red line here showing yes, gut permeability, and it's a root cause of many, many, many things. And it is amazing that we can test for that, and there are lots of evidence-based interventions that we can take to help repair the gut lining, and that really is foundational to overall health.